Hello, Priya.
Yes, ma'am.
Okay. I think Harminder will join us a little later. We'll just wait for Jinsi as well, and then we can start. Right. Okay. Can you all see the screen actually, like the document which I'm sharing?
Yes, ma'am.
Okay. Right. Okay. Just wait for maybe 1 minute more. So we're going to discuss a little bit different topic today. I'll just message Jinsi and see if she's joining. Okay. So, yeah, anyway, let's start. Okay. Let's see. Okay, so I just want you all to just think about these 4 examples and tell me what is missing there and how you can correct these sentences. Okay. First is Mr. Smith has been suffering, and there's a dash, so there's a word missing. Intermittent chest pain since yesterday.
Suffering with.
Suffering
Right.
from.
Okay. So,
No.
was it Vimla? Yeah.
Suffering with.
Okay. So suffering with. Okay. Let me just check this. Okay. Okay. Any other answer?
Suffering from.
Suffering from. Okay. Okay. Okay, Jinsi, can you hear me?
Yes.
Okay, yeah. Okay.
Good afternoon.
So, we just started. Okay, so I just was asking you all to, complete that sentence. Okay, Mr. Smith has been sleeping yesterday. Okay. What do you think, Reshma and Jinsi?
From. Suffering from.
Okay, suffering from. Okay. Both of you? So, Reshma as well?
Yeah.
Okay, yeah. All right. Okay, suffering from. Okay. And okay, let's come back to that again. Okay. And then second one, the treatment depends dash the test results.
On the test.
Pardon?
On.
Okay. Okay. Any other options?
No, ma'am.
Is there any other option or are you all agreeing with this?
Yes, ma'am.
Okay. Reshma, Jinsi?
Yes.
Okay, depends on. Okay. All right. Okay. Are you coping dash the changes?
With the changes.
With the changes.
With.
With. Okay. All of you are telling the same. With. Okay. Now, she was admitted dash osteoarthritis.
With.
With.
With. Okay.
With.
Okay, any other options?
Due to.
Yes.
Oh, what's
Okay.
due to?
Okay, due to. Okay. Okay. All these small words, you know, these words which we're missing. What are they? What are they? Actually, these small, like, you know, the words with, from, on, with, or due to, all these words.
Preposition.
Yes, prepositions. Okay, so these are called prepositions. You might have, like, you know, you might have learned all these things already. But like, I'm just going to go into little detail, like, you know, in our letter writing, the common verbs which we use, and which prepositions like has to be used along with the verbs. You know, sometimes we have like verbs plus preposition combinations, so you should not make mistake. Okay, so the coming on to the first example. Mrs. Smith has been suffering with or from.
From.
So this is okay. So this word, okay, suffering with. Suffering with means, you know, you are suffering along with somebody else. You know, somebody else is also having this chest pain, and you are also suffering this chest pain. Okay, so now we will be telling, you know, you are suffering along with the other person. Okay, something. The meaning will be something like that. So this, you know, the word with will not come here. Okay, so. The correct answer will be from. Okay, suffering from a disease condition, okay, or a problem. Will be a suffering from. Okay, or suffer from. Suffer, with the verb suffer, you should use from if you are using a disease condition, or like in a symptom or whatever it is. Okay, then depends on, that is correct. Are you coping with? Okay, then she was admitted with or due to. Okay, admitted with is okay, and also due to is you are telling a reason, so both are acceptable. Okay, admitted with osteoarthritis and due to osteoarthritis. Okay, all right, good. So now, okay. So there are like different, some types of prepositions, that is like classification, just for you to remember. Okay. Do you know like why we are using this kind of prepositions? Okay, so these prepositions, are they connecting any sentence? Like, I mean, what can be their role actually? Actually, they link, you know, the verbs. Sometimes they link the verbs or the nouns or the pronouns together. Okay, verbs. Sorry. Okay, so this prepositions, they link. What all I told? Yeah, verbs. Yeah.
Verbs.
Yeah, verbs, nouns, pronouns. Okay. Pronouns. Okay, so all these things, they links verbs, pronouns, nouns together. For example, if you see, you know, they are in this one, she was admitted, and there is an osteoarthritis. So admitted is a verb, and there is osteoarthritis a noun. Okay, so it's connecting these two, you know, like a verb and a noun. Okay, something like that. Okay, so that is the role of these prepositions, and there are different types of prepositions. You know, prepositions of time and place and movement or direction, and like, so there are some prepositional phrases that is, you know, we sometimes use it very commonly, that has to be used like that. You know, so okay, so yeah, when we think about prepositions of time, can you think about some examples of prepositions of time?
In, on.
I just want to know, like, because if you are aware of some of these, you know, very commonly we use. Okay, sometimes, you know, these words, these prepositions, for example, if we are using this, what to say, sometimes we use these prepositions. They have sometimes the prepositional role, and sometimes they have also a conjunctional role as well. Okay, they might have 2 or 3 functions. Okay, they might have some things like that. Okay. But okay, so prepositions of time, for example, ago, since, before. Okay, all these are prepositions of time. And there are, like, you know, prepositions of place. For example, you know, we are telling, you know, under the table. Okay, under, behind, between. Okay, all those examples. And then movement or direction, that when you are telling, you know, up and down or over and all those things. Then sometimes we are mentioning the prepositions for, telling that, you have something, that you possess something. In that case, it comes the with, okay, with. Or sometimes, it was done by somebody. So the by is another preposition, okay. Okay, so these are just a rough idea about like what, like, prepositions are, okay. Now I'm just going to, oops, okay, so we will be just focusing on the prepositional phrases or the verb combination, okay, which, okay, yeah. So the first one is verb plus on, okay. So usually when we write verb plus on, for example, it is advise on, okay. So we might be telling, okay, an expert will advise you on the infection control policies or something like that, advise on. Then based on your test results, okay. This is also very like useful for both writing and speaking, okay. We will be telling the patient, isn't it, based on your test results, we will be focusing on this kind of treatment. Or maybe, okay, based on the examination, I believe that you have got this like disease, or like, you will be telling the diagnosis. Okay, so this one. And then concentrate on, congratulate on. If the mother is coming and, I mean, I think there was an example, a role play with a mother coming, like a newly, she was a new parent. So then you can tell something like, when you are congratulating, you can tell, congratulate on your new baby. Or like, yeah, something like that. And then decide on, depend on, focus on, insist on, operate on, rely on. Okay, I just want one or two examples with either like take one or two verbs and just formulate the sentence. Okay, yeah, there now. I think 5 of you are there, so like maybe at least 4 or 5 different sentences. Yeah. Okay. Take one or two examples and I just want to like you to think about some examples. The common sentences you use using these sentences. Advice is a very common verb we use in our letter writing, and that too in the discharge plan.
He was advised
Advice,
to
then base and depend, decide, and all those things are very common in your writing and also speaking.
he was advised on a low-fat diet food.
Okay, so Minder is telling he was advised on
Low-fat diet.
low-fat diet. Good. Okay, he was advised on low-fat diet. Okay. Okay.
His treatment based on his result.
Okay. His treatment.
Based on his result.
Based on his results. Okay. So where is the there is something missing. Okay, Jinsi, I want you to correct this sentence as well. His treatment
Is
based on his result. Okay. His treatment is based on his results, or we will be based on his results. Okay, anyway, okay. Any other, like one more verb, okay, with on. One more example.
He needs to focus on his health.
Okay, he needs to, or if you are telling in speaking, like if you are doing the role play card, how will you tell? You need to focus on, isn't it? You need to focus on what it is.
Your health. Or
Pardon?
your
Focus
your-
on
on
your
your
health.
health.
Okay, you need to focus on your health. Okay, so this is how you might that is very necessary that you should use only the prepositions that are connected to these these combination verbs. Okay, when you use these verbs, should be very careful. Okay, now we're going to discuss some verbs with when we use verb plus with. Okay. So can you think about any example? Okay. So now we have, I think when we discussed that example, there was cope. Okay. Any other example?
Came with the complaints.
Pardon?
Came with the complaints of. Yes.
Came with complaints of. Okay. Come with. Okay. Come. Mhm. But this I mean, there can be like more than one preposition, like combining with a verb. Okay. So it depends upon the situation and the like what idea you want to convey. Okay. Okay. Come with these problems. Okay.
Associated with.
Plus one verb. Diagnosed with, isn't it?
Yes.
He was diagnosed with. Okay. Another example is present. Okay. Oops.
Complaint.
Yeah. Okay. So one is present. So he presented with these complaints, isn't it? With the complaints of or something. You will be writing like that. Okay. So I heard something from Haminder.
Complaint. I just presented with the complaint of.
Presented with. Okay. No. This is like we are telling about the verb combination. Okay. Presented with the complaint. So the with is coming along with presented. Okay. Present verb plus with. Okay. Yeah. The
Associated
with is
with.
not for the word complaint, but for the word with, present. Okay. Yeah. Any other
Mom is associated with like
yes,
we'll tell that.
associated. Yes. That is an example which you use when the patient is having some other, symptoms along with the main complaint. Okay, associated with the vomiting or like nausea and vomiting or something like that. Okay, another example. Okay, in the speaking, you might be telling, I would like to discuss the treatment options with you. Okay, so discuss with. Okay. Right. Any other? Okay. Another example.
Explain.
Continue. Okay. Continue.
Okay.
When you think about a sentence using continue and with,
Explain.
pardon?
Explain. Explain with.
Explain with. Will you say explain with?
Yeah, I'm just trying to make
No.
the sentence.
I don't
Can
think.
we?
Yeah. But with this continue,
Meanwhile, I strongly
pardon? Yeah, meanwhile,
I advise you to continue with the same medication.
continue with the same medication. Okay, please continue with the same treatment or same medication. Okay, yeah. Then cope with, then deal with. Okay, do you know how to deal with these with these situations? Okay, we will be telling. Okay, that is very common. And then communicate with. Communicate with. Okay. Sometimes, you need to use the word confuse. Okay, I got confused with somebody else. Okay, something like if you are like, telling, okay, something confused with. And okay, yeah. Okay, consult. Can you frame a sentence using consult?
We have to consult with a physician before.
Yes, that's right. Okay, I have to consult. Okay, when you are telling, when a patient is, insisting for some other diagnosis that is out of your scope, you can tell I have to consult with the doctor Or if it is for the medicine role play, you will be telling, you know, I have to consult with the specialist. Okay, whatever it is. Okay. Right. Okay. So then, okay, persist. Another example is persist. Okay, persist. Present. Did I write present? Okay, present. Okay, proceed. Okay, then provide. Okay, provide. That is very common. Okay, provide. Can you make a sentence using provide? The pharmacy will provide you with medication for a month. Okay, provide you with. Okay, yeah. Okay, these are like some examples of the verb when we use verb plus with. Okay, the preposition with. Okay. Now, coming on to another example. Okay, now another set of, you know, the combination of verb plus preposition combination. I'm just going to use, you know, can you like think about another combination? Verb plus, let's say 2. Okay, verb plus 2. Okay, just, okay, tell me some examples, verb plus 2. Listen, okay.
Go.
Encourage,
Pardon, what is that?
listen.
Advice to.
Encourage him to do exercise.
Actually, I couldn't actually hear you. What is that?
The patient want
Encourage
to
him
go
to
to.
do.
Okay, now, okay, okay, Harminder, what are you telling?
Encourage him to do exercise.
Encourage, okay, encourage to, okay, okay, encourage.
Advised to quit smoking.
Mm-hmm. Something. Okay. Advice, okay. Another verb, okay. With this to. This advice, you know, this advice will not come. Okay, advice on smoking cessation. That will not come with to actually. Okay.
She was advised to reduce smoking or quit smoking.
Advised to reduce smoking. Okay. Okay.
Follow up.
What was that? I heard something.
Follow up.
Follow up. Follow up. No, follow up is not a verb, isn't it? We will commonly use a word, isn't it? Adhere. Can you formulate a sentence using word adhere?
Make sure that you're
Pardon?
adhering. Make sure that you're adhering to the exercise or diet or whatever.
Yeah, adhere. Okay, okay, okay. Make sure. What is that sentence, please? Pardon. What is that?
Make sure that you're adhering to the.
Yeah, make sure that you adhere. Yeah, adhere to the treatment regime or the medication or whatever it is. Okay, good. Okay. Okay. Any other examples? Okay. There are like a bit more, like some more are there. Belong to. Okay, belong.
Educate.
What was that?
Educate. Education. Educate.
Okay. Okay. Yeah. Okay. So these are like combinations with verb plus to. Okay. Now we're going to say something different, like verb plus from. Verb plus from. Okay. Just tell me some verbs, examples, if you can remember some.
Sometimes started from.
We did mention something like
Suffering
suffer.
from.
Yeah.
Yeah.
Sometimes started from.
Symptoms, pardon?
Started. S-T-A-R-T.
Yeah, started. Just tell me the full sentence.
Migrate.
The symptoms started from yesterday evening.
Oh, okay, started from yesterday evening. Okay. Mhm. Right, okay.
Migrate.
Pardon, migrate. Yeah. Migrate from a place. Okay, good. Benefit. Prevent. Okay. Then protect from, recover from, and all those. Okay, examples are there. Okay, these are some of the other examples. And yes, okay. Now we will look into some more other combinations. Verb plus about. Okay, these are, I'm just going through because, you know, when you write, I mean, you should be like remembering all these combinations and just try to, write correctly in a letter and also when you're speaking. Okay, verb plus about.
Shall we use about in our writing?
Pardon?
Shall we use the word about in our writing?
Yeah, but this will not usually come in your writing, but when you're, when you're speaking.
Okay.
Inform. Okay, inform. Inform. Have you been informed about the risk of this surgery? Okay, have you been informed about the treatment options? Informed about. Okay. Okay, inform, then know about. Okay, know, then learn, almost like kind of like similar kind of verbs. Okay, and then again there is another like combination we can use as verb plus against. Okay, verb plus against. Okay, here also we can use the same verb, advise, advise. Okay, can you think about an example using advise and against?
Against the smoking and drinking.
Pardon?
Advice against the smoking and drinking were given.
Advised against. Okay. Okay, or like another example, you're advised against leaving the hospital. Okay, before you are discharged by your doctor, or like when the patient is trying to self-discharge or like telling something like that. Then in the speaking you can use this word. Okay, you are advised against leaving the hospital before the doctor discharges you. Okay, then the word immunize. Okay, immunize also comes along with the preposition against. Okay. Should I be immunized against hepatitis B? Okay. Should I be immunized against? So that word immunize verb will come along with the word against. And then protect. Protect. Okay. Can you tell any example using the protect? Maybe whenever you are doing the speaking, it will be like, for example, if you are telling, if a patient has come to you for a dressing or like, like some like wound care, and you're telling to, cover the wound or something like that, you can tell an example using that scenario.
Protect against infection.
Yeah, protect it against infection. So it is like, if you are telling something, keeping the wound clean or like covering the wound will help to protect it against infection. Okay, against infection. Okay, so this immunize and protect and vaccinate. Okay, vaccinate. That also
Protect from the
comes along with the word
infection.
against. Then also, you know, decide. Okay, decide against, we can tell. Okay. Okay, if we are deciding like, you know, against some other, you know, the options that is given to us, so, you know, decided against further treatment options, or like decided against. Okay, these are some of the examples of the verbs which we can use, and verb preposition combination. Okay, so just remember all these. And yeah, I'm just thinking of, okay, and another one is verb plus in. Okay, verb plus in. Okay, this some of these are very common actually. Involve. Okay, for example, you know, you will be, you know, advising the patient, you know. This involve or like
Interest.
participate. Participate is also very common in your speaking. Just tell me an example using these verbs. Okay, involve and participate.
Participate in exercise program.
Okay, yeah. If you are telling the no, in speaking, then telling the patient, then okay. Oops. Okay, please participate. Okay, please participate. Participate in an exercise program. Okay. Okay, another with the word involve. Another example. You know, when you're telling the patient to get involved in some other activities, you know, get involved in what else, like some other, you know, like activities. Okay, or like you're telling the patient if they are, you know, if they are a bit socially isolated, or like they are living alone, you're asking them, you know, try to get involved in activities along with your friends or something like that, you know, involved in. Okay, yeah. Okay, good. Okay. So now one more example, and we will just like go on to next one. Okay. So now another example, verb plus for. For. This is like sometimes very commonly we use this. Recommend. Okay, recommend. The word we use very commonly. Okay. What treatment do you recommend for this one? Okay, if the patient, like, you know, or like, you know, when we, like, the treatment we recommend for this treatment is. Okay, okay, all right. And then refer. Okay, refer we can use with like, okay, refer for this specialist test. Okay, I will be, or you will be telling, I'm going to refer you for this for the biopsy. Okay, or like any specialized treatment for. Okay, but if you are referring to a specialist, you will be telling, I will refer you to the surgeon. Okay, so that refer will can come along with for and also to. Then any other? Then same thing related to the refer is a prescribe, you know. When we tell that, okay, when you're telling the patient, no, or when you're writing as well, you know, antibiotics were prescribed for the infection, or for example, I'm telling, okay, prescribed for, prescribe plus for. Any other example? Arrange. Okay, arrange plus, okay, sorry, arrange plus for. Physiotherapy sessions, or like, okay, I will, okay, you will be telling, you know, I will arrange for the physiotherapy sessions. Okay, or pay for. Okay, I'll pay for this. You will be telling, yeah. Okay. These are some examples. Please wait for the doctor. Okay. Please wait for the specialist opinion. Okay. Wait for. Okay. These are some of the combinations which you have to use when you think about the prepositions and the usage of the right way of using prepositions. Okay. All right. Okay. So I'm just going to I'm just going to end the session, but just log back using the same link, but just take maybe 1 or 2 minutes. Okay. Otherwise, it will not work. I think last time it happened like that, isn't it? So okay. Yeah.
Yes.
Yeah. Right.